understanding autism. So about 75 million people in the world have autism. We know that it is not caused by vaccines or environmental factors. And we know that boys are 4 times more likely to have autism than girls. Autism has often have co-occurring conditions. This might include depression, anxiety, hyperactivity, and the intellectual functioning varies. That's why it's called a spectrum.
Individu dengan autism seringkali mengalami kondisi yang terjadi bersamaan, termasuk depresi, kecemasan, defisit perhatian, kesulitan hiperaktif, dan perilaku yang menantang. Tingkat fungsi intelektual pada orang individu dengan autism sangat bervariasi, mulai dari tingkat gangguan yang sangat parah hingga tingkat yang superior atau hebat.
So again, that's why we don't call it linear. It's not less autistic and more autistic. It's a spectrum. So every individual with autism is different and unique in their own way. Their skills and their abilities and their difficulties all varies. So screening tools, there's 2 ways to confirm an autism diagnosis. One way is through, or I guess I should say the first step is through screening tools. You might see this in a pediatric office when they have questionnaires for developmental milestones. They might ask when your child started walking and any kind of speech difficulties and milestones that they may have hit or missed. That's called a screening tool, and that's used for early detection. And it's more pointing towards signs that there might be a developmental delay. And then we also have diagnostic tools, and that is where a certified licensed physician, like a psychologist, might confirm or confirm the presence or the absence of the autism diagnosis and various other conditions as well. Usually we use what's called the DSM-5. It's a specific assessment, and it has specific criteria to be met to confirm an autism diagnosis.
Di sini ada perbedaan antara screening tools dengan diagnosis tools. Alat screening terutama digunakan untuk mendeteksi dini kondisi seperti anak autism. Sedangkan alat-alat diagnostik digunakan untuk memastikan kondisi atau kekurangannya. Seringkali alat screening ini digunakan oleh dokter misalnya yang berupa kuesioner kepada orang tua. Alat-alat diagnostik ASD atau Autism Spectrum Disorder termasuk DSM-5 yang memiliki kriteria khusus untuk mendiagnosis individu dengan autistik.
Yeah, there was a video. I think maybe because we had to download the presentation, but the video was about self-stimulatory behaviors and what that might look like and feel like for people with autism. I'll be sure that the video works when we send it out, so you guys can actually see it. It's a really good video. Oh, maybe it's going to come up. Maybe it just needs time. You let me know when we should give up. I'm gonna, cause no good? Oh. Okay. Well, self-stimulatory behaviors, also known as stimming or stims, are repetition of different sounds, body movements, other behaviors that actually neurotypical and neurodivergent people do. Somebody in the crowd, I'm sure, is tapping their knee. That would be considered a stim. So it's more prevalent with individuals with autism, but everybody does it. And it's a way of coping. And so that's what the video is about, of what it feels like to stim and what it feels like to try to suppress that stim. So we'll make sure you have the video whenever it goes out.
Iya. Perilaku stimulasi diri atau stimming atau stims adalah pengulangan gerakan fisik, suara atau perilaku lain yang ditunjukkan pada populasi neurotypical atau juga yang dilakukan oleh neurodivergent. Oke, terima kasih.
Okay, so then we have ADHD, attention deficit hyperactivity disorder. You might also know this as ADD. It used to be called both ADD and ADHD. Now it's just widely ADHD. In the 2023 global study, about 8% of the participants had ADHD. The prevalence is also more likely in boys than girls. And the cause is unknown. There's some evidence that it's genetic, and then there's some evidence that it's environmental, and sometimes both. It is described as persistent patterns and inattentive, impulsive, or hyperactive behavior. Oh.
Sekarang kita akan memahami mengenai ADHD. Di sini dikatakan bahwa ADHD adalah pola perilaku yang memiliki tidak perhatian atau lalai, impulsif, dan terkadang hiperaktif yang terus-menerus. Dan ada kalanya seringkali disertai dengan tantangan self-regulation, emotion.
So there's 3 different types. There's inattentive, there's hyperactive, and there's combination. And it's exactly what it sounds like. There's ADHD that looks like extreme inattentiveness, where the student or the individual is not paying attention. Maybe they're zoned out. You might heard the phrase. There's also hyperactive, which again is exactly what it sounds like. I've heard the phrase bouncing off the walls. And then there's combination. You might see a little bit of both. That one is the most common, as you can imagine.
ADHD biasanya diikuti dengan inattentive atau adanya kurang perhatian, hyperactive, dan juga kombinasi dari keduanya.
So this may look like emotional dysregulation, anxiety, impulsiveness, disorganization, and excessive motor needs. You might notice as well that a lot of these characteristics of somebody with ADHD can also present as somebody with autism. And that's really important when you're seeking some kind of diagnosis, especially because if somebody has autism, it might present as these characteristics as well. So it's important that you choose carefully your physician and that you trust your providers because these can look so similar.
Ini adalah diantaranya beberapa karakteristik yang dimiliki oleh seorang ADHD, anxiety, disorganization, emotional dysregulation, impulsiveness, excessive motor needs.
I don't think this video is going to probably work either. So this was actually a TED Talk. Again, you'll have it whenever we distribute this, but if you want to look it up on your own, it's a TED Talk of somebody with ADHD. She's an adult now, and she explains her experience coping with ADHD and what that looked like for her growing up in the school system. So we'll see it another time.
Ini seharusnya ada video mengenai seorang ADHD, orang dewasa perempuan. Dia melakukannya di TED Talk.
So next we will talk about school-based services. We're going to go over different terminologies that you might see when you have a student in a school system, as well as the different settings that you might be exposed to and all of that. So there's 4 main service providers that you might come in contact with. There's therapists, like occupational therapists and speech therapists. There's teachers, and that includes learning support teachers or special education teachers, as well as classroom teachers. There's support assistants, which I've heard a bunch of different names, like learning support assistants, teaching assistants, aides, shadow teachers. And then there's other service providers, which include counselors and school psychologists.
Ini adalah pelayanan berbasis sekolah, terdiri dari teachers yang biasa kita sebut dengan support teachers atau guru pendukung, dan juga ada terapis, biasanya diikuti oleh occupational therapist atau speech therapist. Ada juga support assistant, dan juga ada provider lainnya seperti counselor sekolah atau school psychologist, psikologi sekolah.
So first we'll go over There we go. First, we'll go over occupational therapists. Occupational therapists provide direct and indirect services. Some schools have direct services where there's therapy sessions, and then other schools have indirect services where the occupational therapist helps the service providers who then help the student. So they work on gross motor, fine motor skills, sometimes behavior and emotional dysregulation, as well as sensory issues. The overall goal and purpose of the occupational therapist is to increase independence in the classroom, whether that is through behavior and social emotional skills, or whether that's the physicality of navigating the classroom.
Salah satu terapis yang disediakan di sekolah biasanya adalah occupational therapy atau terapi okupasi. Terapi okupasi memberikan layanan langsung dan tidak langsung untuk mendukung keterampilan motorik kasar dan motorik halus seorang siswa, pengaturan perilaku dan emosi, dan juga masalah sensorik. Melalui sesi terapi langsung, bisa juga konsultasi dengan staf dan juga akan memantau penilaian kemajuan. Tujuan akhir dari terapi okupasi ini adalah agar siswa dapat meningkatkan kemandirian ketika menavigasi lingkungan belajar yang paling tidak membatasi diri mereka.
So next we have speech therapists. Again, they provide direct and indirect services. The direct services look like one-on-one and sometimes group therapy sessions. The indirect services look like, again, collaborating with classroom teachers and other staff to help reinforce those skills that are worked on in the sessions. This includes receptive language, so that means listening language, and expressive language, which is talking, social language, and articulation. They do progress monitoring and assessments to determine if there's some kind of speech impairment. Oftentimes you'll see individuals with autism also have a co-occurring condition like a speech impairment.
Salah satu pelayanan yang lainnya adalah terapi bicara atau speech therapy. Biasanya terapi bicara bekerja sama juga dengan guru-guru di sekolah tersebut, memberikan layanan langsung dan tidak langsung kepada siswa yang mengalami kesulitan dalam bahasa reseptif, bahasa ekspresif, bahasa sosial, dan juga artikulasi. Melalui sesi terapi bicara, bisa terapi langsung, konsultasi dengan staf, dan juga memantau penilaian kemajuan siswa. Tujuan akhir dari terapi bicara adalah agar siswa dapat mengeneralisasikan keterampilan ini di kelas umum dan kehidupan sehari-hari, sehingga menghasilkan interaksi sosial yang positif.
So next we have teachers. Classroom teachers, also known as mainstream teachers or general education teachers, teach a curriculum for the age-appropriate year level. So for example, if a classroom teacher teaches year 2, then the curriculum is age-appropriate to year 2. That means that when they have a learning support student in their classroom, they are differentiating, accommodating, and modifying that curriculum to promote inclusion and facilitate that inclusion in the classroom. And so they service all students, neurotypical and neurodivergent.
Guru kelas reguler atau mainstream juga berperan sangat penting untuk mendukung pembelajaran siswa dengan berkebutuhan khusus. Diharapkan guru mainstream juga mempromosikan lingkungan belajar yang inklusif, bekerjasama dengan staf lain yang terkait. Guru mainstream juga melaksanakan pembelajaran buat anak siswa tersebut dengan mengembangkan dan memberikan tugas dan kegiatan yang harus dibedakan, diakomodasikan, ataupun dimodifikasi.
So next we have support teachers, also known as learning support teachers, special education teachers. Miss Rennie is a learning support teacher, and we have some other learning support teachers in the crowd here. So a learning support teacher has a bunch of different roles, and it looks like a million different things depending on the student and the setting in the school. Mainly, their job is to implement the education plans of the learning support students. That means, again, accommodating, modifying, differentiating that individualized instruction. That might mean that they push into the classroom and support instruction that way, or they pull the student out of the classroom into a specialized setting and they support the student that way and give individualized instruction.
Ya, benar, saya adalah salah satu learning support teacher. Mungkin ini saya bisa memberikan juga secara gambaran secara umum. Jadi tugas saya sebagai learning support teacher bekerja sama dengan guru kelas di mainstream. Saya role-nya adalah memodifikasi pelajaran untuk anak berkebutuhan khusus dan juga memberikan akses pada anak berkebutuhan khusus untuk bisa menerima pelajaran di kelas mainstream-nya. Dan biasanya yang saya lakukan adalah saya menarik anak tersebut ke kelas yang mandiri atau juga anak tersebut bisa bergabung di kelas mainstream.
So next we have support assistants, or we did. There we go. Also known as learning support assistants, teaching assistants, aid, shadow teachers. They also support in the classroom and out of the classroom. The main difference is that the teacher is responsible for the first teach or instruction and the curriculum of that student. The shadow teacher or the learning support assistant is responsible for continuing that instruction and reinforcing that instruction. A lot of times this goes through repetition and providing those accommodations so they continue to access the mainstream environment or the individual education plan. Again, it's additional support. They also collect data and progress monitoring to make sure that the student is continuing to improve their performance.
Learning support assistant atau istilah umumnya shadow teacher. Kebetulan di sini ada banyak learning support assistant dari AIS. Terima kasih supportnya. Learning support assistant mempunyai peran bekerja dengan siswa berkebutuhan khusus tertentu. Biasanya mereka ini yang mendelivery lessonnya, memberikan dukungan tambahan kepada siswa tersebut sesuai dengan rencana pendidikan siswa yang diberikan oleh guru learning support ataupun guru kelasnya. Dan learning support assistant juga bertugas mengumpulkan data mengenai kinerja performance dari siswa tersebut.
So next we have school counselors. Not all schools have, and I should say this too, not all schools have learning support assistants and not all schools have counselors. The school counselor's job is to address these skills: personal, social, academic, and career. And also, specifically for learning support students, the counselor is really vital for that social emotional well-being. Sometimes we have students who also access the school counselor services, even though they're not directly related to a learning support department. There's still a key piece to the student's learning. This can be done through individual or group counseling sessions, classroom lessons, consultation with families and service providers, like the ones that we just talked about, and the overall well-being of the student.
Servis yang lainnya adalah konselor sekolah. Biasanya mereka ini bekerja sama dengan semua siswa, termasuk siswa berkebutuhan khusus, untuk meningkatkan perkembangan dan prestasi siswa melalui sesi konseling, individu atau kelompok, pembelajaran di kelas, dan juga konsultasi dengan penyedia layanan lainnya.
So also there's school psychologists. Again, not every school is going to have a school psychologist. A school psychologist is qualified to provide psychological assessments, like the diagnostic tools that we talked about, to determine educational diagnosis, because there is a difference between medical diagnosis and an educational need. Sometimes an individual might have autism, but it's not presenting in a way that's affecting their education, and that's okay. So a school psychologist would be qualified to make those determinations. A school psychologist also provides ongoing services like behavior intervention, social skills, that kind of thing. They also work really closely with the school counselor as well.
Psikolog sekolah juga merupakan profesi yang sangat penting di suatu sekolahan. Mereka berperan untuk memenuhi syarat dan memberikan penilaian atau assessment psikologi guna menentukan diagnosis pendidikan yang mempengaruhi kinerja sekolah tersebut. Psikolog sekolah juga merupakan sumber bagi penyedia layanan di bidang perilaku, keterampilan sosial, dan juga kesejahteraan mental yang berkaitan dengan kinerja sekolah dan kesejahteraan secara keseluruhan.
So the least restrictive environment means that it's an individualized education setting that a student is most successful with the least restrictions. Sometimes, based on the student's needs and abilities and difficulties, their least restrictive environment might be a self-contained special education life skills setting, which is the most restrictive. So even though it's the most restrictive setting in a school setting, it's the least restrictive for them to be successful. So we have this visual here that goes from least restrictive to most restrictive. And you'll see that the general education classroom, also known as the mainstream classroom, is the least restrictive because that's where your same age peers are learning the age-appropriate content for their year level.
Ya, di sini ada setting pendidikan individu di mana tadi dikatakan ada least restriction environment, di mana siswa dapat ditempatkan pada lingkungan pendidikan yang paling sedikit pembatasannya, seperti misalnya setting di kelas mainstream, di mana seorang individu dengan berkebutuhan khusus bisa belajar di homeroom, di general education classroom, ataupun mungkin akan the most restrictive yaitu lebih kepada mungkin di special needs school atau di hospital atau residential facility.
So there's two main settings. There's the mainstream setting, which also you might hear general education setting or inclusion setting. Those are all the same thing. And then there's also a self-contained setting or a special education setting, and some might say life skills setting, depending on the age and the content that they're teaching. There's a million variations between the two that you might consider hybrid, but these are the two main settings that we're going to be looking at. The mainstream setting is an educational setting of same-age learners, while the self-contained setting is designed to have specialized supports that are individualized to the student.
Di sini ada dua yang sangat utama, yaitu setting dengan kelas mainstream atau dengan setting dengan self-contained atau ruang mandiri khusus. Setting kelas mainstream biasanya disediakan oleh untuk pelajar dengan seusia mereka yang sama, sementara untuk setting yang self-contained atau ruang khusus dirancang untuk memberikan dukungan khusus kepada siswa yang berkebutuhan khusus.
So this is a visual that might help you understand what inclusion means. Inclusion is an educational setting and activities that are differentiated to meet the needs of all students, whether that student is working on skills that are below those of their same age peers or higher than their same age peers. So you'll see that, for example, if a student is in a wheelchair, it would can be considered exclusion to have a fence there where they could not see at all. It would be considered an adaptation to lift that student up so they can see over, but it would be inclusion to just change the fence so that there's no extra supports needed for them to be included in the activity.
Ya, intinya di sini ada setting inclusion, di mana ada 3 jenis, exclusion, reasonable adaptation, and inclusion. Jadi setting kegiatan pendidikan dibedakan sesuai dengan kebutuhan dan kemampuan seluruh siswa yang berkebutuhan khusus.
So we have 4 main modes of instruction that you might see when shopping for schools. There's push-in instruction, pull-out instruction, co-teach instruction, and in-class support. So push-in instruction is exactly what it sounds like when a teacher or a staff member pushes into the mainstream classroom to support the student or provide extra instruction. Pull-out instruction, again, is what it sounds like. The student is being pulled out for more individualized, direct, intense instruction. We have co-teach instruction, which means that there's 2 teachers, usually 1 mainstream teacher and 1 specialist. That might be an English as an additional language specialist, or it might be a special education teacher, where they work together to deliver instruction. Sometimes they co-teach looks like taking turns, and then sometimes co-teach means that they just provide support afterwards, or they pull a small group during that time. It just depends on the school and the classroom. And then we have in-class support, which is very similar to the push-in instruction, but in-class support a lot of the times is used as a supplemental resource for students.
Ada 4 jenis instruksi. Yang satu adalah push-in instruction, di mana di sini seperti terlihat di gambar, seorang guru, baik itu guru dari IEL atau spesialis, dia melakukan small group activity di dalam kelas regulernya. Lalu ada pull out instruction, itu di mana siswa berkebutuhan khusus ditarik keluar dari kelas mainstream untuk melakukan sesi one-on-one, misalnya sesi terapi bicara, OT, ataupun sesi khusus dengan dengan learning support teacher. Lalu ada co-teach instruction, ini biasanya ada bekerja sama antara guru kelas mainstream dan juga dengan guru spesialis atau dengan guru IEL. Guru IEL itu guru bahasa Inggris yang diadakan di kelas mainstream tersebut. Jadi mereka bekerja sama untuk melakukan pembelajaran dengan murid-muridnya. Dan in-class support ini artinya adalah bisa seorang learning support assistant bekerja sama khusus dengan siswa berkebutuhan khusus secara individu, tetapi tetap di ruangan kelas yang mainstream.
So you may have heard of an IEP. That means it's an individualized education plan. This may include many components. The ones that are required would be assessments and reports that you're using to develop the IEP. Present levels of academic achievement and functional performance, also known as PLAF. We have goals and objectives, modifications and or accommodations, specific support services, and then sometimes students might have a behavior intervention plan within that. The purpose of the IEP is to develop evidence-based strategies and services in agreement with the family that details specific services that are provided required for that student to be successful. The key word there is individualized. It truly can be however the team, family included especially, wants it to look.
Mungkin Bapak Ibu pernah dengar dengan istilah IEP, Individualized Educational Plan. Mungkin kalau di sekolah nasional ada istilahnya RPPI ya Pak ya? PPI, oke. Nah di sini berisi assessment atau penilaian atau laporan dari assessment seorang siswa, mungkin laporan psikologi assessment atau OT dan speech-nya. Dan juga terdiri dari performance atau tingkat pencapaian siswa secara akademik ataupun fungsional yang terkini. Jadi kita akan mendata kira-kira anak ini kekuatannya di mana dan kekurangannya di mana. Lalu ada juga tujuan, goal dan objektif, tujuan dan maksudnya untuk membuat IEP ini. Lalu ada support services, artinya pelayanan apa yang diberikan oleh siswa berkebutuhan khusus. Yang terakhir ada behavior intervention plan atau rencana intervention perilaku.
So a part of that IEP, one of the most important parts, is the present levels of academic achievement and functional performance. This will include the student's strengths in each core subject, their difficulties, and again, it includes academic subjects and functional skills. So this might be literacy, math, science, behavior, social skills, self-help skills, daily living skills, speech and communication skills, as well as fine and gross motor skills and any kind of other sensory needs.
Jadi di dalam IEP kita juga mendata kelebihan dari seorang siswa itu apa saja. Biasanya guru kelas dan juga guru support, kita mendata kira-kira siswa A, mereka punya kekuatan di mana, dari sisi akademik, mungkin dari sisi literasinya atau numerasinya. Dan juga kita mencatat difficulties-nya apa, misalnya anak tersebut mungkin masih harus meningkatkan dari sisi kemampuan motorik kasar, kita juga menulis di situ. Dan di situ juga ada academic subject-nya, secara akademik dan juga secara functional skill, artinya secara sosial juga kita perlu mendata strength dan difficult-nya dari siswa tersebut.
So also you might see accommodations or modifications. So specifically, modifications are educational tools or strategies that support the student by changing the expectation or the content being taught. So for example, you might change the level of reading text that a student is reading. Maybe they are in a year 3 classroom, but the specific text that they're going to be assessed on is for a year 2 level. That would be considered a modification, as well as sometimes providing a calculator during a test would be a modification. Also, a lot of times on IEPs, you'll see a student receiving a modification for using key concepts instead of the entire curriculum. That would be considered a modification.
Modifikasi adalah alat atau strategi pendidikan yang mendukung siswa dengan mengubah ekspektasi atau konten pembelajaran. Misalnya dalam hal ini seorang anak mungkin di kelas 5 tapi ternyata level of readingnya masih di kelas 2, itu kita bisa modifikasi dengan memberikan reading level sesuai dengan kebutuhannya. Lalu juga kita bisa menyediakan kalkulator pada saat anak tersebut tes, karena mungkin ini adalah salah satu yang bisa dia lakukan sebagai alat bantu kepada dia.
So next we have accommodations. These are also tools, but it's a little bit different. Accommodations are, again, strategies and tools that support the student by changing the way the student accesses the content of their same age peers. So that might be, for example, highlighting notes. When we highlight notes, we're not changing any expectations, we're just helping the student access that content. Reminders to stay on task, providing breaks throughout. And then reducing the length of the assignment too might be an accommodation for a student who maybe has low stamina but is able to perform.
Akomodasi adalah alat atau strategi pendidikan yang mendukung siswa dengan mengubah cara siswa mengakses konten, instruksi ataupun aktivitas dari tugas tersebut. Misalnya di sini kita bisa menggunakan highlighting notes untuk biar mereka fokus kepada kontennya, dan juga selalu mengingatkan untuk stay on task, untuk terus bekerja, untuk terus belajar, dan jangan lupa kita perlu memberikan istirahat atau breaks. Jadi katakan dalam selang 10 menit mereka belajar, lalu jangan lupa kita berikan breaks. Setelah itu kita juga bisa mengurangi jumlah tugas yang dia lakukan. Misalnya kalau teman lainnya melakukan tugas 10, dia cukup mungkin 5.
So we have a little visual of a better way to understand the differences between accommodations and modifications. You'll see that the accommodations lift the student up to help them access that content, and the modifications bring the level down of the content so that the student can reach it. So next we have a functional behavior assessment. The functional behavior assessment is an assessment that is completed to determine why a student may engage in problem behaviors. If your student or child is not engaging in problem behaviors at school, you probably never see this. But if they are, whether that is any kind of reluctance to do work or follow instructions or the group plan or any kind of disruptive behaviors like that, the school might ask for your consent to perform a functional behavior assessment. This is an example of what that looks like. All it is the staff member taking data on the behavior that's taking place and what's happening before and after that's contributing or causing that behavior. And that's how we determine what we're going to do next to help the student.
Ini adalah contoh dari functional behavior assessment, merupakan penilaian perilaku fungsional atau penilaian yang diselesaikan untuk menentukan mengapa seorang siswa mungkin terlibat dalam perilaku bermasalah. Contohnya misalnya yang pertama itu siapa yang mengobserve, misalnya salah satu guru mengobserve ada kejadian sesuatu. Kita tulis juga tanggal berapa dan tepatnya di mana. Lalu actionnya apa? Jadi jadi misalnya kejadiannya apa, lalu setelah itu anak tersebut melakukan perilaku seperti apa. Dan lalu yang terakhir adalah konsekuensi yang diberikan pada anak tersebut pada saat melakukan perilaku. Dan ini semua dicatat oleh seorang guru atau learning support assistant.
So after we do the functional behavior assessment, we would develop what's called a behavior intervention plan, also known as a BIP. So that is when we have the problem behavior and we've used the assessment to figure out why it's happening. The functional behavior plan includes why it's happening, what exactly is happening, which includes definitions, examples of the behavior, and then strategies that the staff will use to help decrease those behaviors. So these are the 4 main components that you'll see on a behavior plan. The problem behavior, definitions, examples, preventative strategies, because that's just as important as what we call consequence strategies, Also, additional skills we might teach. For example, if a student is yelling in class in protest, we're not just going to provide consequences for those behaviors to decrease the behavior. We're also going to provide instruction on skills that are going to help prevent it, like asking for a break or asking for help. Those are the additional skills that we might teach. And then also strategies, again, for what happens after the behavior occurs.
Behavior Intervention Plan adalah rencana intervensi perilaku yang menggunakan data dari penilaian perilaku fungsional untuk menentukan perilaku yang bermasalah. Mengapa perilaku tersebut bermasalah terjadi, dan keterampilan khusus apa yang diajarkan, serta strategi yang diterapkan untuk melakukan perilaku tersebut.
So next we have life skills, or the life skills setting. The life skills setting is an educational program that is designed to provide functional and meaningful instruction for a special education student who has deficits in the area of daily living activities. Typically, you'll see this more at the high school level, and this includes tasks like cooking and dressing, personal hygiene, navigating the community, money skills, and social skills.
Life skill atau kecakapan hidup atau keterampilan hidup adalah program pendidikan yang dirancang untuk memberikan pengajaran yang fungsional. Dan ini bermakna kepada siswa bersiswa berkebutuhan khusus yang memiliki kekurangan dalam bidang aktivitas kehidupan sehari-hari. Beberapa contoh life skill adalah misalnya memasak, dressing up itu bagaimana cara berpakaian, personal hygiene, menjaga kebersihan diri, navigating the community, explore dengan lingkungan sosialnya, dan juga pemahaman mengenai uang. Misalnya pada saat mereka belanja, mereka juga perlu tahu bagaimana menggunakan uang. Dan social skill, bagaimana mereka berinteraksi dengan teman-temannya dan keluarganya.
So next we have goals and objectives. These are another main component of the education plan. Typically when a student is not able to fully access the mainstream curriculum, they'll have individualized goals and objectives that are integrated into their instruction. It's the same areas that you might see in the present levels of academic achievement and functional performance, and we use the PLAF to gear the goals. So any kind of difficulties we see in the PLAFs, that's what we're going to use to determine and write the goals for their curriculum, for their individualized curriculum. Sometimes they're supplemental to the mainstream curriculum, so you might have a student who accesses the mainstream curriculum and receives instruction in that way, but then they also have individualized goals.
Maksud dan tujuan dari IP dikembangkan berdasarkan PLAF. PLAF itu yang tadi ada performance dari seorang siswa yang awal ya. Nah, sasaran dan tujuan tersebut merupakan pelengkap dari pengajaran umum atau dirancang untuk menjadi fokus utama pengajaran untuk siswa berkebutuhan khusus. Di sini ada, silakan.
So we'll go over, did you have more to say about the?
No,
Okay.
actually I just want to give some example of this.
Oh yeah.
Oke, di sini contohnya misalnya literasi, matematik, perilaku, self-help itu atau life skill, vocational, speech itu speech, wicara, bahasa, dan juga motor skill dan social skill yang juga dipertimbangkan dalam melakukan goals dan objektif di IP.
So that was most of all of the really key terms that you might see in a student's education plan, or somebody who is considered a learning support student, especially when you're looking for a school that may provide supports that your student may need. So now we'll move on to an example of an admissions process. This is the general steps that you might see when interviewing AIS. So we'll go over that. So step one is you would take a tour. This is obviously optional, but it's definitely a good idea for you to put eyes on the school and exactly what the culture is like, because that's going to tell you a lot about their ideas of inclusion and what that specifically looks like in their school.
Kami memberikan gambaran bagaimana proses penerimaan siswa di AIS. Tahap pertama adalah bisa melihat ke sekolah langsung, melakukan tur sekolah. tapi ini optional, tidak harus.
So step 2 would be you would complete an application online.
Ya, langkah kedua adalah mengisi aplikasi secara online.
It's very important that when you fill out these applications that you're very, very, very honest about your student. And I know sometimes it might feel beneficial to leave some information out because you want your student to have a chance. And I understand that. But when you're shopping for a school, if a school can't provide the services that your child needs or is not willing to, you don't want that school anyway. So it's better to just be honest up front, and that's going to tell you a lot about a school if they're able and willing to accommodate your child.
Can I translate, Madison?
Sorry?
Can I translate?
Yeah.
Yang utama pada saat mengisi aplikasi, diharapkan pada orang tua jujur mengenai anak Bapak Ibu sendiri, karena dengan jujur kita akan tahu bisa mengakomodir kebutuhan dari siswa tersebut.
So step 3 would be to send the required documents. In an ideal world, when you're accepted to a school, the staff will be able to develop an education plan specific for your child before they enter the school, so that everybody is prepared and that we can start making progress from day one. But to be able to do that, especially if it's a new school, we don't know your student yet. So how can we make an education plan based on your student if we've never worked with them? That's where the required documents come into play. And it's so important that any and everything that may be helpful, like psychologist reports, past progress reports, or even a letter from previous doctors or teachers or anything, any kind of information is very helpful, so that we can get the education plan developed as soon as possible.
Tahap ketiga adalah mengirim semua dokumen yang dibutuhkan oleh sekolah. Misalnya ada laporan dari psikologi assessment atau laporan dari sekolah sebelumnya dan juga laporan atau report dari akademik siswa tersebut. Ini sangat penting dibutuhkan untuk sekolah yang berikutnya karena kita akan melihat semua data yang ada di situ.
Step 4 would to be for AIS specifically would be to complete an in-person interview with your child. This is very helpful because even though you might send all of these reports and it's extensive and complete and a big picture of your child, that's just paper. Your child is more than just paper. So having an in-person interview allows the staff to, it's not about judgment of your child or your family or anything. It's to get to know you and to be able to be confident when we say, yes, we can accept your child and we have all the supports ready and able for your child.
Langkah keempat adalah interview atau wawancara langsung dengan anak tersebut. Misalnya kalau Bapak Ibu ingin memasukkan anak tersebut di sekolah kami, alangkah baiknya membawa anak tersebut untuk kami interview. Jadi meskipun sudah mengirim semua dokumen yang diperlukan, tapi ini adalah salah satu tahap yang sangat penting sehingga kita bisa bertemu langsung dengan anak tersebut.
So step 5 would be to provide payment usually, and then the reason why I include that is because a lot of times schools will have an additional fee for their learning support services. Obviously this varies from school to school, and again, those services are individualized. There's not just a package deal because your child is unique and their services are unique, and so that reflects that as well.
Tahap yang terakhir adalah pembayaran tuition fee atau uang sekolah. Di sini juga akan ditentukan apakah anak tersebut akan menerima support dari sekolah tersebut, misalnya ada support yang dibutuhkan, apakah membutuhkan shadow teacher, OT, ataupun speech. Dan ini adalah langkah yang sangat penting.
I want to add to that. Another reason why I included this is because a lot of times if your student requires a learning support assistant, usually that has to be prepared before your child can start. So there might be some waiting time depending on the availability of those staff members.
Dan juga yang dipertimbangkan adalah apakah anak tersebut membutuhkan learning support atau shadow teacher, dan ini kita butuhkan informasi tersebut supaya kita bisa melakukan tahap selanjutnya.
Okay, so that's it for us. Now it's your turn to ask questions.
Sekian presentasi dari kami.
Thank you. And thank you, Ms. Rennie.
Thank you.
Amazing.
Mungkin kalau ada tanya jawab, dipersilakan.
Yeah, okay. Or the first question.
Peer model.
Yeah, peer modeling. Yep.
My question is about the universal design for learning in the first part. Multiple means of engagement. Is it effective for teaching students with ADHD and autism?
My personal opinion, whatever is good for everybody else is good for them. That might come with accommodations and modifications and differentiation, of course. And sometimes adaptation. Sometimes adaptation is the best way and the least restrictive way, and that's okay as long as inclusion is in mind. And then I think you're going to have to repeat your second question.
What kind of life skills appropriate for students for autism and ADHD? Life skills.
I mean, that depends on the student. Every person with autism and every person with ADHD is so different. So it depends on what their current skill set is. Another main thing is it depends on what's important to the family. If the family has a lot of interest in traveling, then being out in the community and learning how to ride on a train appropriately, or just those skills might be a more priority in the school setting to learn than somebody else whose family doesn't really prioritize traveling, and maybe they, as a family, really enjoy cooking. So I think it just depends on the student. You might also be asking about life skills that allow for more inclusion. And we do this a lot in our learning support classroom, is we think about what skills are needed in order to participate in the classroom. And we also call this learning to learn. So, for example, that means you need to be able to sit in a chair for an extended amount of time. You need to be able to raise your hand when you have something to say instead of blurting. Those are all life skills that go beyond the classroom, but are definitely important in the classroom to be able to access. And then, sorry, repeat your third question.
So what kind of strategy for teaching students with autism and ADHD in case of literacy?
In literacy, you said? That's a good question. It's hard to say because, again, everybody is so individual that, I mean, whether they're neurodivergent or neurotypical, it depends on what their current skill set is. As far as strategies, a lot of times with both autism and ADHD, the strategies we're using are more to help their learning skills rather than the actual academic skill that you're teaching. So what can we do to reinforce the prerequisite skills that allow them access to the literacy instruction? Beyond that, using visuals is amazing for students with autism. Using visuals whenever and wherever you can. Ms. Rennie, do you have any ideas for literacy strategies that you might use in the classroom right now?
Yes.
Perfect.
I think all the teachers try to modify it or try to give as simple as can be. For example, I have a student who is in year 2, but the level of reading, we can say she's still in the level foundation. Or I can say she can still read maybe one word at a time. Or even she's still able to read one letter sound. So instead of she's 8 years old, so I try to use a different kind of visual cards. And of course, repetition is a very good strategy. So I always tell my colleague, we never, please don't get bored to teach the student, because these students, they never get bored. Teaching them repetition makes them a success. So I think what we do, repetition, visual card, and of course we need to set the level of their skills.
I'll also add that a lot of times with students with autism, a whole word approach is preferred over teaching phonics. And again, it depends on the student, but sometimes students with autism, their memory is so good, and so to use that strength can be helpful in the reading world as well.
Yeah, agree. Ada lagi yang mau bertanya?
Thank you very much. It's very interesting to hear your explanations. In my knowledge, student-centered learning is very modified now. In AIs, I mean, in your school, is it any certain strategies about student-centered learning? Because you said there's prerequisite knowledge that can subdue the students to another level. Maybe you can answer. Thank you.
So you're asking for strategies that help support the student-centered learning, specifically in the mainstream environment, I'm assuming?
Yeah.
Yeah. So you're asking for strategies that help support the student-centered learning, specifically in the mainstream environment, I'm assuming?
Yeah.
Yeah. So I know I'm a broken record. It depends on the student. It will always depend on the student, and I think that's what's special and so unique about the special education world is that it truly is individualized to the student. One student might be really amazing in math, and another student is not, and that's okay. Again, it just depends on their strengths and their difficulties, and that changes as well. Same with neurotypical kiddos. So specifically students with autism, they are visual learners. They are multisensory learners. So that means that you would incorporate movement and all the different senses when teaching that instruction to make sure that they grasp the content in every way that they can. And then repetition, always, always, always repetition. Yeah, do you want to add anything?
No, I think that's it. Ada lagi mau bertanya? Pak Ranu spesial.
Oh no. Now it's a quiz.
No, just from me, I guess, you know, the process and the prerequisite of like an inclusion school is very, I guess, it's very difficult in a way. But most schools in Indonesia right now have to be inclusion in a way. But my question would be, if, say, family finds a school is not in accordance with their needs in a way, should they continue to enroll in that school or find an alternative way of educating that might be suited to them, you know?
In a perfect world, all of these supports and needs wouldn't come at an extra cost. And so I realized that it's unfortunate that some of these services are really only available to the privileged. So yes, in a perfect world, they should find somebody or organization who is willing and able to give their student everything, because also the goal is for students to not need a million supports to be able to access their community. That's the goal, is to teach to independence, or as close as possible, whatever that independence looks like for that child. And so you also need a school that can be flexible in that just because you have a learning support assistant doesn't mean you're always going to have a learning support assistant, or doesn't mean that you're always going to have a learning support assistant that provides direct all-day support, that it can change with the level of the student and the performance. So yes, in a perfect world, you would find a school that can provide all that, but I do realize that that might not be available to everybody. And so I would say to the first thing, because I have personal experience talking to families about this problem, that maybe they were at a school or looked at a school that said simply they cannot help their child. And I would just simply ask why. Why are you not capable? Because having experienced AIS, we are all capable. I don't know how else to say. I would just push it. Ask why. And if they have an answer, ask why that's a barrier. And just keep pushing it. If you really like a school and for some reason they're not meeting all of your students' needs, keep asking why and keep asking for a solution. And I would hope that a school would do everything in their power to find a solution for your student.
Ada lagi yang mau bertanya? Boleh pakai bahasa Indonesia, nanti ditranslate kalau bisa.
Iya, halo saya Putra. Dulu mungkin waktu penelitian ya, zaman saya tesis itu untuk di autism memang sangat ngetren waktu itu ABA ya, Applied Behavior Analysis, especially for autism ya. Dulu saya combine dengan video modeling, with video modeling and a lot of visual cards and anything else to teach the autism kids how to understand emotions and how to express emotion appropriately. Ya, ada nggak sekarang pendekatan mungkin yang lain gitu ya, atau masih sangat berlaku ABA gitu ya, yang juga mungkin diterapkan di sekolah saat ini, misalnya di AIS atau di Australia secara nationwide gitu ya, yang mungkin dirasa udah cukup efektif dan mungkin bisa jadi alternatif baru selain ABA gitu ya. Karena saya kalau ngeliat ABA kan sangat reward and punishment gitu ya. Tapi siapa tahu ada pendekatan lain yang mungkin approach-nya sedikit berbeda gitu ya. Apakah positifis mungkin alirannya atau humanis atau apapun itu atau kognitif gitu ya. Penasaran aja seperti apa di sana gitu. Thank you.
Terima kasih Pak. This is your field, medicine.
I know, I heard so many fun words.
But basically, he asked whether is there any another strategy or approach other than ABA that currently used, applied in Australia or worldwide?
So ABA is considered a treatment, specifically therapy for students with autism, that is evidence-based and proven. But ABA, specifically as a science, is just that. It's a science to behavior, not just behavior of kids with autism, but you and me. It's sometimes I hear people say, "Oh, I don't believe in ABA," or "We don't, do that," and I have to chuckle in my brain a little bit because that's like saying you don't believe in math. Math is everywhere. Math is here, this length and area of the table. It's everywhere, and so is ABA. Behavior is everywhere, and there's reasons why behavior occurs. So when you ask if there's another treatment for autism other than ABA, there are various different therapies and services that help students with autism, but at the end of the day, those therapies, even though they have different activities and it looks different than ABA therapy, if they are showing progress in behavior, it's because they're using ABA. Because behavior happens. That's the end of it. And there's reasons why it happens. So to answer your question, yes, there's speech therapy that works on social skills and behavior skills through communication. There's occupational therapy who help with the interoception or the feelings that are happening on the inside, like your heart rate and all of that help with behavior. I've heard of a therapy called floor time, which I think goes along with occupational therapy. And those are all very effective. But the reason why students with autism have such success with ABA, when you find a good service provider, just like any profession, is because their behaviors are typically what gets in the way of learning. It's not that they're not capable of learning. It's not that they don't have great intellect. It's that their behaviors don't allow them to access that content or their communication. And with all of that, it's because behavior. Behavior is everything. Behavior is talking, it's walking, it's everything. So I'm pro ABA if you can't tell. So.
Cukup, Pak. Boleh mungkin satu lagi pertanyaan? Ada lagi, Bapak Ibu? Cukup mungkin? Pak Randi cukup? Oke.
Did I survive?
Yeah.
Well, thank you guys. You guys are amazing. Those are good questions, and I appreciate everybody coming. This was great.
Terima
And
kasih
thank you for
banyak
having us.
partisipasinya.